Okay, we're going to go ahead and get started. We're going to cover most of chapter 15 today. And this chapter starts our last few chapters, and they're all going to have to do with life cycle nutrition. Everything that we've talked about so far has been what a healthy adult needs. And that's what all the nutrition standards are built around. So now we're going to look at particular stages in your life where you may have slightly different needs, higher needs, or may need to avoid certain things. So chapter 15 mainly deals with pregnancy. A lot of people know they need to start eating a healthy diet and follow a healthy lifestyle once they get pregnant. But what a lot of people don't realize is that good nutrition and good health is really important to have before you get pregnant. And it also, good nutrition and good health affect both a man's and a female's fertility. We usually just focus on the female, but it does affect the male as well. So some things that you want to do before you get pregnant. Achieve and maintain a healthy body weight. We're going to talk later that there's risk if you're underweight and get pregnant. A lot of people have issues with infertility if they're underweight, but there's also a lot of risk for the mother and the baby if the mother is overweight or obese when she gets pregnant. Choose an adequate and healthy and a balanced diet, so make sure you're getting all the nutrients that you need. Be physically active. Ideally, you would already have an established exercise or be active in your daily lifestyle before you get pregnant so that you can continue that while you're pregnant. Regular medical care, manage chronic conditions if you have diabetes, if you have high blood pressure. Make sure those are under control and you're able to manage those well. And then avoid harmful substances, cigarettes, alcohol, drugs, that type of thing. Okay, so they say a new life begins at conception when a sperm fertilizes an egg. It takes place in the uterus. The amniotic sac is going to develop in the uterus, and it's kind of like a big balloon-like sac that's fluid-filled. Amniotic fluid is inside of it, and it's going to hold the fetus for the whole period while it develops until it's born. The umbilical cord is kind of like a rope-like structure that connects the amniotic sac to the mother's blood supply, and it's going to deliver nutrients and oxygen to the fetus, but it's also going to take waste away and remove it. The placenta is essentially what keeps the baby alive. It's how the baby gets oxygen. It's how the baby gets nutrients. It's how it gets rid of waste for the baby. So it is really key. Okay. When a sperm fertilizes an egg or an ovum, it's the Greek word for egg, you have what they call a zygote. And it starts rapidly dividing, and it will implant in the uterus wall. I believe around 2 weeks, it is now known as what we call an embryo. And it's called an embryo from weeks 2 to week 8. Okay. And then after week 8, and let me also point out, while it's an embryo, this is when it's laying the roots or the groundwork for all the major systems in the body. Okay. After week 8 until it's born, it is referred to as a fetus. Full-term pregnancies are 38 to 42 weeks. Okay. You'll feel on average a healthy pregnancy is 40 weeks. But 38 to 42 weeks is what is considered a full-term or healthy pregnancy. Okay, and these just show the different periods of development. This is a zygote. It says it's about the size of a period at the end of this sentence. This picture 2 is an embryo at about 5 weeks. You can start to see, kind of looks like a tadpole, but you can start to see some of the, you can see that's the head and that's the body. Picture 3 is a fetus at 11 weeks, and then obviously you have a newborn infant in the last picture. Okay, critical periods. These are defined periods of intense development and cell division. And these are things that have to occur at specific times. And if anything goes wrong during this period of critical development, there's going to be some kind of permanent damage. Okay? It may be mild or it may be serious, but there's some kind of permanent damage to the baby. There's no like going back and fixing it later. They talk about neural tube development. The critical period for neural tube development, and the neural tube is going to be what is going to turn into the spinal cord and the brain and the nervous system. Okay? So the critical period for laying down the base of that nervous system and brain in the baby is days 17 through 30. That means there's some major development, intense groundwork being laid. And if anything happens or disrupts that, there's going to be an issue in that baby with the brain, with the spinal cord, with the nervous system. Okay? Now, days 17 through 30. The issue with that is most women do not know they are even pregnant at days 17 and 30. Most people don't find out. The earliest they usually find out is around 4 weeks. It's around it. So towards the end of this period. But some people don't find out until later than that. So you can see these are the critical periods and these are the weeks. Ooh, sorry. So you can see if you don't find out that you're pregnant maybe until week 5 or 6, well, you've already started the critical development for the nervous system, for the heart, for the ears, for the eyes, for the legs, and for the arms. So maybe you didn't know you were pregnant, so you've been drinking, you've been smoking, you haven't been eating a healthy diet, getting all the vitamins and minerals. That won't definitely have an effect on the body, but had you known, you probably wouldn't have been doing a lot of those things. Okay, some of the neural tube defects that you see when there is a problem during the critical development. Anencephalus is where the brain is either missing or doesn't develop all the way. Spina bifida, this one is a little more common, and it's where the spinal cord doesn't close up. And so typically the baby is born with part of the spinal cord exposed. They can do surgery to fix that. But what happens is the baby is typically paralyzed from where it's exposed to that point down. And there's nothing you can do. They don't really know the cause, but they do know that adequate folate intake greatly reduces the risk of this occurring, which is one of the reasons why it's so key to be eating a healthy diet before you even get pregnant. In fact, they recommend that people actually supplement folate and make sure, even if you're not planning to get pregnant, if you're a female of childbearing age, because we know there are lots of pregnancies that happen without being planned, that you are trying to get lots of folate in your diet. And those are going to be like your leafy green vegetables, lots of your produce, but particularly your leafy green vegetables. Other things that increase risk of neural tube defects: if you've had a previous pregnancy with a baby with a neural tube defect, if you have diabetes, if the mother does, if you take anti-seizure medications, if the mother's obese, if she is exposed to high temperatures early on in pregnancy, like in a jacuzzi or in a hot tub or sauna. Certain races and ethnicities have a higher risk or rates, and then a lower socioeconomic status. And that is typically because people of lower socioeconomic status may not have the resources or the money to be getting adequate health care, to be eating a healthy diet, that type of thing. So folate supplementation does reduce the risk of neural tube defects. They actually supplemented all the grain products. I guess this is back in maybe the 70s or 80s. When they found this research, they added a little bit of folate to all of our bread and grain products, like our cereals, our breads, crackers, that kind of thing. It's just a little bit, but just that little bit of supplementation to the food supply has greatly reduced the number of neural tube defects. Okay. Not going to worry about the fetal programming. There's a lot of research looking at chronic diseases. This is kind of a new area of research, but looking at things like if the mother is malnourished while she's pregnant. Well, some research has suggested that that will cause the baby, when it's an adult, to develop type 2 diabetes. Now, these are hard to look at because you have to have long-scale research studies, and it's hard to show the exact causation. Inadequate growth in the womb of the baby. Some studies have linked that to hypertension in the baby when it's an adult. So kind of an interesting area that we don't really think about, but there's some new research looking at those kind of things. Okay, let's talk about the mother's weight. The mother's weight prior to getting pregnant and then the mother's weight during pregnancy greatly influences the baby's health at birth. Okay? The birth weight of the baby is kind of one of the first key indicators you can look at to tell if the baby's healthy or not. Babies with higher weights typically have fewer risk. Your lower weight ones you're going to worry about. But let's talk about the mother's weight, and let's talk about it before she gets pregnant. If the mother is underweight when she gets pregnant, underweight mothers, remember that means BMI of less than 18.5, tend to have lower birth weight babies. And I just said your lower birth weight babies tend to have issues. They also have higher rates of preterm birth. And preterm birth is when the baby's born before 38 weeks. Remember I told you a healthy pregnancy was 38 to 40 weeks? Preterm is when the baby comes before 38. Okay? Now everything may end up being fine, but typically they say ideally a baby would have at least 38 weeks in the womb. Also, mothers that are underweight have higher rate of infant death. Okay, if the mother is overweight or obese when she gets pregnant, babies tend to be born post-term, which means late, means after 42 weeks. Most doctors won't let you go past 42 weeks now. But like I said, 38 to 42 weeks is the ideal time. You want to stay in there long enough, but after 42 weeks, there's no reason for the baby to be in there anymore. So post-term isn't really good either. They also tend to have big babies, meaning 9 pounds or more at birth, which is a big baby, and that's called macrosomia. They also tend to have more difficult labor and delivery, birth trauma, and a higher rate of needing a C-section, likely because that baby's bigger. Higher risk for neural tube defects, heart defects, and other abnormalities. However, if you are overweight or obese and you get pregnant, that is not the time, pregnancy is not the time to try to lose weight. Okay? So that's why they say try to lose some weight or get to a healthy weight before you get pregnant. So let's talk about now, okay, if you are overweight or obese, how much do you need to gain? Or if you're a healthy weight, how much do you need to gain? Okay, so the mother's weight gain is going to very closely correlate with the infant weight. And the infant weight is one of the best predictors of the baby's health. Okay? The mother's recommended weight gain is based on the number of babies that she's having, how many fetuses, and then her starting weight and what her starting BMI is. Okay? A lot of people, and this is not as true as it used to be, but a lot of people think it's a time you can eat whatever you want, eating for two, that kind of thing. It's really not the case. So let's look at what the recommended weight gains are. Okay, and we're just going to look at the column that says for a single birth. Let's look at the healthy weight. Your BMI is 18.5 to 24.9. During the course of the pregnancy, you want to gain 25 to 35 pounds. So at the end of that pregnancy, you don't want to be under 25 pounds. You don't want to be over 35. Okay? If you're overweight when you get pregnant, you still need to gain some weight, but it's less. You want to gain 15 to 25 pounds. Okay? If you're obese when you get pregnant, you still need to gain some weight as well, but it's less. It's 11 to 20 pounds. Okay? Now, if you're underweight, you need to gain more. You need to gain 28 to 40 pounds. But you can see, unless you're having more than one baby, or unless you're underweight, you really don't need to go over 35 pounds of weight gain. And I've heard people who gain 70, 80, 90 pounds. It's just really not healthy and not needed. Okay, so they say the weight gain patterns, this always makes me laugh. 3.5 pounds in the first trimester. The pregnancy is going to be broken into trimesters, which are typically about 3 12 to 13 week periods. We call the first 12 to 13 weeks the first trimester, the second trimester, and the last the third trimester. They say 3.5 pounds in the first trimester, and then after that, 1 pound per week thereafter. This makes me think it was written by a man, because this is not exactly how it works if you've ever been pregnant. A lot of people don't gain any weight that first trimester because they're nauseous or they're sick. I've even heard of some people losing weight because they can't keep anything down, because that's when you see a lot of morning sickness. With both of my pregnancies, I gained more than 3.5 pounds my first trimester. And then my weight gain slowed down, and it was mainly because I could only eat carbs. I couldn't eat protein, I couldn't eat vegetables. It just made me nauseous. So it differs person to person. The bottom line is that you stay within that recommended range. Components of weight gain. Let's look at this, because a lot of people think, especially females, think, oh, I don't want to gain 30 pounds, whatever. Well, when you look at this, it shows you only about, and this is based on a woman at a healthy weight needing to gain 25 to 35 pounds, only 7 of these 30 pounds are from fat. And the reason you add those fat stores is the mother needs a little bit extra to be able to make milk. So here's where the other pounds are. Increase in breast size, increase in fluid volume, your blood supply doubles, you've got this amniotic fluid. The placenta, increase in blood supply to the placenta, amniotic fluid. The infant itself at birth, on average, 7.5 pounds, maybe a little more. Increase in size of the uterus and the muscles supporting it, and then you've got the mother's fat stores. So you can see all of this weight gain really has a purpose. So it's not like gaining 30 pounds of fat. Okay. Return to pre-pregnancy weight. It really depends on if the mother stayed within those recommended ranges. If you gained the 25 to 35 pounds, then most likely you will return to your pre-pregnancy weight. It may take a little work, may take a little time, but you will likely return to it. If you gained more than that, then a lot of those women you don't see return to their pre-pregnancy weight. In fact, they say most women tend to retain a couple of pounds with each pregnancy. So you may start out at a healthy weight before you have your first child, and let's say you have 4 kids and you held on to 5 pounds with each kid. Well, after you've had 4 kids, that's an extra 20 pounds. You may now be overweight. So it just kind of slowly adds on. When you retain weight, it increases your risk for diabetes and high blood pressure, and also other chronic diseases later in your life. Exercise during pregnancy. Some people still think, especially some of your older people, that you just need to lay on the couch and put your feet up. And that is actually not true. Unless you're a high-risk pregnancy and your doctor has told you, do not exercise. Exercise is actually encouraged during pregnancy. Ideally, you will already be doing some activity before you get pregnant, so you're just not getting pregnant starting an exercise program. You may have to adjust the duration and the intensity. But it improves your overall fitness. It prevents gestational diabetes. It facilitates labor or helps you have an easier labor, and it also reduces stress. I think it also helps with staying within that recommended weight range. They recommend low-impact activities. This is going to vary doctor by doctor. I ran through my 6 month of pregnancy. My doctor said it was fine. That wouldn't really normally be considered a low-impact activity. So it just depends on your doctor. The one thing you do want to watch out is you don't want to get an excessively high body temperature. So if it's like the middle of the summer and you're working out, probably a good idea to go in the air conditioning and run on the treadmill or do something inside with a fan or something. Don't go out in the heat and get your body temperature extremely high. Don't get your heart rate super high. And these are some guidelines that they give. They aren't that different from regular exercise guidelines. Okay. Let's talk about nutrition needs. So a lot of things are going on in the mother's body. So it's because she has an extra need for nutrients for the growing baby. You need to make sure you're getting an adequate, healthy diet, as well as gaining at a healthy rate, not gaining too fast or too slow, getting some activity. Most doctors will give you a prenatal supplement. Typically, you need more iron, you may need more calcium, may need more folate, and the prenatal supplements are like a prenatal vitamin that have all those extra nutrients in them. And then you want to avoid harmful things, tobacco, alcohol, drugs, that type of thing. Even some over-the-counter drugs can be harmful to the baby. Okay, nutrient needs. Your nutrient needs are highest during pregnancy and lactation. Lactation is breastfeeding, essentially. So we'll be talking more about that. Your body does become a little smarter. It absorbs more of the nutrients that you take in, and it doesn't excrete as many, so it holds on to those nutrients better. And you do need a little extra calories, but it's not typically as many calories as people think. Let's see. Go to the calories, and then I'll come back. They're in here. Oh, no. Okay, let's talk about the calorie needs. That first trimester, the mother does not need any extra calories. Okay? Remember that zygote and that fetus is about the size of a period at the end of a sentence. Okay? That doesn't require many calories. Okay? So the mother needs no extra calories. The second trimester, which is typically about week 13, 14 through 28, week 28, the baby is getting a little bigger. Okay? And so as it gets bigger, it does have increased needs. So the second trimester, the mother needs around 340 extra calories per day. But 340 calories, if you think about it, that's not much. Okay? That's not much at all. And then the third trimester, which is typically weeks like 28 till 40, or when the baby's born, you need 450 calories per day. Okay? So again, that's the most you need, but it probably isn't as many calories per day as most people think. So when people say eating for two, that's not really the case. This is an extra milk serving, extra fruit serving, extra carb, that kind of thing. You want to make sure you're getting ample carbohydrate. Pregnancy is not the time to cut out carbs or go low carb. Your protein needs go up about 25 grams per day, higher. So you take your RDA and add about 25 grams to that. You really want to get it from food and not protein powders or supplements. Essential fatty acids, omega-3 and omega-6 fatty acids. These have been found to be really key in brain development and eye development. They're found in like a lot of your fatty fish, a lot of your nuts, avocados. And because they're so key, some OBGYNs will give you supplements of the essential fatty acids. I have a 9 and a almost 6-year-old, and with my 9-year-old, they didn't give me a supplement, but evidently research came out between the two, because when I was pregnant with my second one, they gave me an essential fatty acid supplement to make sure I'm getting plenty of these omega fatty acids. Okay. Your body is creating new cells in the fetus rapidly. The mother's blood supply is more than doubling. So because of that, creation of new cells and new blood, these needs greatly go up. Folate, B12, keep forgetting it. Iron and zinc. You need to make sure you're getting plenty of vitamin D and calcium, because you're going to have bone development in the fetus. Also, the baby kind of really sucks a lot of the mother's nutrients out of her. And so in order for the mother's body to kind of bounce back, as well as her to build up her nutrient reserves again and kind of recover from the pregnancy, they recommend that you take 18 to 23 months before you have another baby. So when that baby is 1.5 to 2 years, then you get pregnant. That's adequate time for your body to build its nutrient stores back, for it to recover, for it to be ready to support and grow another baby. Now, we know people who have them very close together and everything turns out, but ideally, this is the optimal interval. Okay, vegetarian diets, they can be fine. You want to make sure it can be healthy. You do need to plan them well. Make sure you're getting adequate calories. Want to try to include milk and milk products. Get a variety of foods, with beans, cereals, fruits, vegetables, nuts. If you're vegan, you may need additional supplementation. It's very hard to meet your needs, all your nutrient needs on a vegan diet, so those aren't quite as healthy, but a vegetarian diet can be fine. Okay, nutrition-related concerns. One of the most common is what they call morning sickness or nausea. They say it is from all the hormonal changes, the rush of hormones in your body that occur right after you get pregnant and during those first 12, 13, 14 weeks. Some people are just nauseous. They never throw up. Other people are nauseous and do get sick. It can range from mild queasiness to debilitating nausea and vomiting, like having to be hospitalized because you can't keep any fluids down. Now, I don't know why it's called morning sickness, because it can occur any time of day. A lot of people, you just kind of have it all day. Kind of feels like, I just had nausea, and it kind of feels like you're car sick / hungover, and there's like nothing you can do to fix it. It's, yeah, kind of frustrating because there's nothing you can do. You know, you think something sounds good to eat, so you get it, and then you eat it, and you feel sick, and yeah. Other people may get sick. And so for most people who just have nausea, it's more of a pain. You may start to have very strong food aversions, can only eat certain things. But typically it goes away around the end of the first trimester. Not always. Some people have it their whole pregnancy. I actually had a student one time who was out a lot, and every time she came out, she'd have a hospital excuse. And she finally told me she was she had morning sickness and was so nauseous and was vomiting so much she had to be hospitalized several times to get fluids and nutrients in her. And so I assumed that was probably her only pregnancy, if that was, she was like that. And she said, no, it was her third. And every pregnancy had been like that. And she said, my favorite meal is the one right after I have the baby because, I really hadn't been able to eat anything and enjoy it for 9 months. So that's a very extreme situation. But okay, things you can do to help alleviate morning sickness: eat desired foods, eat what sounds good. Usually, like your dry carbohydrates, like plain bread, plain pasta, plain crackers. Kind of like thinking like you have the stomach bug, that kind of thing. Those kind of things. Eat dry toast or crackers, chew gum or hard candy. Eat small, frequent meals so that you don't ever get too full, but that you also don't get too hungry. So eat small, frequent meals. Avoid offensive foods. If it doesn't sound good, don't eat it. Carbonated beverages can help sometimes to settle your stomach. Ginger can help some. That's why a lot of people you see drinking like ginger ale. There's also some ginger that you can actually chew that some people says help. Avoid citrus, coffee, tea, water, or milk if that doesn't sound good, because sometimes those can make you feel more nauseous. Okay, constipation and hemorrhoids. Your muscle tone in your whole body is relaxing and loosening in preparation for childbirth. And also your organs, your digestive tract is getting squished as the baby gets bigger. So the end result is sometimes your digestive tract doesn't work as efficiently as it should because the muscles are kind of relaxed. They aren't getting things out of your body. Plus, you've got this baby sitting on all your intestines. So constipation can be an issue. Want to get plenty of high-fiber foods. Exercise is really one of the best things for constipation. Get plenty of liquids in. Okay, heartburn. Heartburn is very common, and again, it goes back to those muscles being more relaxed. You remember when you swallow, it goes into the esophagus and into the stomach. Okay, there is a sphincter muscle in between the esophagus and stomach that controls the passage of food. So when it opens, then the food can move from the esophagus to the stomach. So the food moves in there and it mixes with all those acidic digestive juices, the hydrochloric acid and all that. Okay. Well, when you're pregnant, you've got this big weight on you, and you've also got relaxed muscle tone in your GI muscles. So what is very common is the pressure of the baby pushes on the stomach, and that sphincter muscle opens because it's more relaxed, and the partially digested food that's been mixed with all the acidic juices comes back up, and that's what causes the heartburn. It's the acid that you feel in your esophagus. You want to eat slowly, chew the food thoroughly, eat small, frequent meals. You don't want your stomach to be super full because that's going to make it more likely for it to come back up. Drink liquids between meals. And again, that's to keep the stomach less full. Avoid spicy or greasy foods. Sit up while eating. Wait an hour after eating before laying down. Wait 2 hours after eating before exercising. Okay, food cravings and aversions. These are very common. They are due to hormones. Some people like to think, oh, if I'm craving ice cream, then that must mean my body needs calcium, so I need to eat it. That is not, research has not shown that to be true. They tend to be caused strictly by hormones. But they are very common. There are certain foods you can't even stand the thought of, and then there are certain foods that you can't get out of your head. Also, there are non-food cravings, and we talked about this in the mineral chapter, pica. This is very common. It's common in iron-deficient individuals in particular. It's where they eat non-food substances like clay, like ice, like cornstarch, dirt, those types of things. They think it's related to the iron deficiency that makes them crave it, but eating that non-food substance doesn't help the iron deficiency. Okay, let's talk about high-risk pregnancies. A high-risk pregnancy is going to be one that threatens the life of the mother and or the infant. There's a lot of things that you can do to avoid a high-risk pregnancy. Proper nutrition, avoiding alcohol, drugs, smoking, getting adequate medical care during the pregnancy. If you have something like diabetes or high blood pressure, trying to manage that. A low-risk pregnancy is going to be one without risk factors. So, a high-risk pregnancy is likely to affect the infant's birth weight. Okay? And what often happens is you see babies with a low birth weight. And a low birth weight is defined as a baby that's 5.5 pounds or less. Okay? That's little, that's considered too little to really be healthy. It may be fine, but ideally you want the baby to be a little bit bigger. It's associated, when you have a low birth weight infant, you often have complications during delivery. Typically you see it in mothers of a lower socioeconomic status. They probably haven't had access or ability to get medical care during their pregnancy or have prenatal vitamins or an adequate diet. They may have been using drugs or smoking or that kind of thing. Now, when you have a preterm infant, an infant born between 38 weeks, a lot of those infants are going to have low birth weights, okay, because they didn't get to stay in the womb the full amount of time to finish putting on their weight, okay? So there are two types of preterm infants that you see. There's a preterm infant that is what they call appropriate for gestational age. So maybe the baby was born at 36 weeks and it weighed 5 pounds. But that 5 pounds is appropriate, or what you would expect for a 36-week infant. And had it stayed in 40 weeks, it would have been at a healthy body weight. Does that make sense? Okay. So it's preterm, but it's appropriate for gestational age. It's appropriate, the weight is appropriate for the number of weeks it is. Then there's small for gestational age. And this is what's not good. This is a baby, let's say that baby was born at 36 weeks and it weighed 3 pounds. Well, 3 pounds is small for a 36-week baby, okay? Whether it's in the womb or it's been born, okay? So it is smaller than it should be for 36 weeks, okay? You worry about those babies because those are ones that have typically had some kind of growth failure or disruption in growth in the womb. And those babies, they can catch up and they can be fine, but they do struggle to catch up. You really have to work with them. Okay, so here's some of the high-risk pregnancy factors. If you are, your weight prior to pregnancy, if it's underweight or if you are overweight or obese. Weight during pregnancy, the mother's weight during pregnancy, if you don't gain enough, okay, or if you gain too much. The mother's diet, if she has any deficiencies or toxicities, or if she has an eating disorder, that type of thing, that may affect the baby. Socioeconomic status, lifestyle habits like smoking, alcohol, drug use, that kind of thing. Age, if the mother is 15 years or younger, her body's still developing. Okay, so not only is the mother's body still developing, but now she's growing a baby in there, so that automatically makes her a high-risk pregnancy. And then women 35 years or older. Nowadays, it is not a weird thing for someone 35 or older to have a baby, but ideally, your 20s are kind of when your body's primed to have babies, and your risk for certain conditions does go up after the age of 35. Number of previous pregnancies, If you've had a lot of pregnancies, if you've had 3 or more and you're younger than age 20, or you've had 4 or more and you're over 20. Intervals between pregnancies. So if you got pregnant with your second baby before it had been 18 months, okay, you had the baby, and then when the baby was 6 months, you got pregnant again. That would be a short interval. Or let's say you had one baby, and then it was 6 years before you had your second baby. That would be considered a really long interval. So a lot of times they'll classify those as high risk. And that doesn't mean you're going to have any problems. They just watch you a little closer a lot of times. Outcomes of previous pregnancies, if you had problems with some of your past ones. Multiple births, if you had twins or triplets, or you are pregnant with twins or triplets, or more than that, which can occur these days, you'll definitely be high risk. They can watch you closer. If your previous babies had low birth weights or high birth weights. The mother's health, if she has high blood pressure, if she has diabetes, if she has a heart issue, a kidney issue, any kind of chronic condition, then she's automatically going to be high risk. Okay, malnutrition. Malnutrition and food deprivation reduces fertility. Men will lose the ability to produce sperm. Women will go through amenorrhea, which means their menstrual cycle stops. And basically, you're malnourished. So your body is kind of shutting you down so that you can't reproduce. It's saying you're not healthy right now. You don't have everything you need to have a healthy pregnancy. So typically, you also see a decrease in sexual interest during starvation or malnutrition as well, because, and again, that's kind of your body shutting things down. Let's see. If you're malnourished early on in pregnancy, you're going to see sometimes problems with the placenta, or sometimes development in the infant during one of those critical periods. You may see fetal growth retardation, some congenital malformations, things don't develop properly. Sometimes you see spontaneous abortion, which is kind of like a miscarriage, or stillbirth, and that's where you carry the baby full term and then the baby is born dead or deceased. Yeah. Premature birth or a low infant birth weight. There are some food assistance programs that are really good out there. WIC is one of them, and it's a nutrition program. WIC stands for Women, Infants, and Children. You have to qualify, but the threshold to qualify is not that low. A lot of people qualify, or a lot of people that aren't in it would qualify, and they don't know about it. But it's a great program. What it is when the mother's pregnant, it provides her with nutritious foods, things like beans, cereal, milk, peanut butter, bread, nutrient-dense foods. And then once the baby is born, it still provides her with healthy food. It will help her breastfeed if that's what she wants to do, but if not, they will provide the mother with formula. I don't know if anybody's checked the price of formula, but it's pretty expensive. And then it will continue to provide the mother those nutritious foods until the baby is age 5, because about that time the baby would probably start school. So it's a really good program that a lot of people don't take advantage of. Okay, so let's talk about the mom's health a little, because if she's got something going on with her health, that's really going to affect the pregnancy. So pre-existing diabetes, let's say she has diabetes before she gets pregnant. You really want her to manage it well before she even gets pregnant, and to have proper medical care. Risks that you see with women who have diabetes, sometimes they have infertility, hypoglycemia, really low blood sugar or really high blood sugar, miscarriages, or sometimes it can cause you to have high blood pressure during pregnancy. Now, there's also a type of diabetes that develops just during pregnancy, and it's called gestational diabetes. It's pretty common. They screen every pregnant woman for this. And a lot of times it may be people who've gained more weight than they should, but sometimes there's no real rhyme or reason to it. Your body just develops this temporary form of diabetes during pregnancy. They do something called a glucose tolerance test, and basically they give you a really syrupy drink and then watch your blood sugar. Your body should naturally produce insulin and pull that blood sugar down, but if your body doesn't do that, then they'll do a longer glucose tolerance test, and then they can diagnose you if they know that they can tell that you do have gestational diabetes. Things that put you at risk for that: if you're older than 25, if you're overweight or obese, or if you've gained excessive weight in the pregnancy. If you've had complications in previous pregnancies, symptoms of diabetes, family history of diabetes, also Hispanics, African Americans, Native Americans, Asian Americans, and Pacific Islanders are at higher risk to develop it. The reason they test for this is if you have gestational diabetes, and that means your blood sugar, blood glucose, is going to be running really high. If your blood sugar is running higher than it should, well, everything that's in the mother's blood is going to go to the baby. So that means the baby is getting more sugar than it needs. Okay? So what you typically see, unless gestational diabetes is managed well, is big babies. Like your 9-pound, your 10-pound babies. And so that's why they want you to manage it well. Because with those big babies is when you see more delivery complications, more C-sections, those types of things. Okay, hypertension. If you have chronic hypertension, so if you have high blood pressure before you get pregnant, you really want to manage it well. You are at higher risk for a heart attack or stroke, but it can be managed. You typically see mothers with hypertension have lower birth weight babies, so you'll automatically be higher risk, so they can watch you closer. Sometimes you see the placenta separating from the uterine wall, which can cause an automatic miscarriage. But again, these are not necessarily saying this will happen to you if you have high blood pressure when you get pregnant. It's just a risk. Okay, what you also see a lot is people who don't normally have high blood pressure, but during the second or third trimester, they develop high blood pressure. So it's referred to as gestational hypertension. It's likely due to all the extra stress on the body, the extra weight on the body. And so it's typically mild, and it usually returns to normal after you have the baby. But they will watch it closely. And one of the reasons they watch it closely is because high blood pressure can be a sign of preeclampsia. Not always, but it can be a sign. Preeclampsia, you have high blood pressure, but you also have protein in the urine. Those are the two key signs. And if you have preeclampsia, they will try to hold your blood pressure stable, keep it from going up farther. And a lot of the techniques or drugs work. But sometimes it will keep going up and they can't get it down. And the only thing that stops preeclampsia is to deliver the baby. Okay? So they don't want to deliver the baby early, but at the same time, if preeclampsia continues, it can develop to eclampsia, which causes seizure, coma, and can cause the mother to die. So they're weighing the options here. They don't want the mother to die, or they don't want the blood pressure to go up so the mother's at risk of dying, but yet they want to keep the baby in as long as they can. If anybody watches the Duggars in the family that's got like 21 kids, y'all know what I'm talking about? On TLC. Okay, that last baby that she had, I think it was the last one. It's about 5 years ago now. They delivered that baby at like 22 weeks, which is really early. But the reason they had to deliver it that early is because she developed preeclampsia and her blood pressure was getting so high, her life was at risk. So they had to, and I think the baby's fine, but that's why they had to deliver it, because nothing stops that preeclampsia or eclampsia except delivering the baby. Okay, ideally, the ideal age to have children for a female is 20 to 25. In this day and age, that's not the age most girls want to have babies. Some do. But a lot of times during college, you're working, that kind of thing. But that's the ideal age. But you know people, and I do too, that have had babies before then or after that, and they're fine. Teenagers having babies, you have a higher risk of complications, higher risk of stillbirths, preterm births, low birth weight infants. There may be some different weight gain recommendations. A lot of times they may need to gain a little more. And they definitely need prenatal care as well as social support. They may need some financial support. Hopefully, it's a family situation where the parents are supportive, or at least supportive of a good pregnancy. They may not be happy their daughter is pregnant, but they will get her to the doctor and make sure she's healthy and that kind of thing. Okay, older women who are pregnant, you see complications, but a lot of times they're related to issues the mother has already. Like she's older, so she's got high blood pressure when she gets pregnant, or maybe she has type 2 diabetes or that kind of thing. You see higher rates of C-sections, maternal death rates are higher, and you see a higher rate of birth defects. You see here, after the age of 35, the risk of an infant with Down syndrome, or at 40, is 1 in 100. So, but again, lots of women over 35 have had babies that are completely healthy, but it's just there is a slightly higher risk. Okay, alcohol consumption can cause what they fetal alcohol syndrome, which is irreversible mental and physical retardation. There's the highlight at the end of your chapter is on that, so look through that. Some drugs, just because it's a prescription drug or it's sold over the counter, doesn't mean it's safe for when you're pregnant. So you always want to check those out. Herbal supplements, you really want to check those out with your doctor first or avoid those. And then illegal drugs are definitely not good for when you're pregnant. Tobacco, you want to avoid. They found that SIDS is sudden infant death syndrome. It's where the baby is healthy and then maybe like at 2 months you put it down to sleep and you go get it an hour or two later and it's died. That's sudden infant death syndrome. And there's no rhyme or reason. Research has suggested that mothers and newborns that are around cigarette smoke are more likely to die from SIDS. So, kind of interesting. Environmental contaminants, lead, mercury. Mercury is going to be in things like fish, certain fish. So you want to make sure you choose your fish or make good fish choices. And then certain foodborne illnesses, bacteria or viruses or harmful things in food that wouldn't normally make other people sick. May make a pregnant person sick. And one of the ones you worry about is listeriosis. It is in like your sandwich meat. And so sometimes you'll hear, a pregnant woman will want her sandwich heated up or grilled or something so that she can eat it. If you heat it up and cook it, it's usually fine. And most sandwich meat does not have listeriosis. But if it does, then it can cause you to miscarry. Things like cheeses that aren't pasteurized, like you buy it from a dairy and it's not pasteurized, those are at risk. So you want to be careful about those. Not really a time to take supplements of vitamins and minerals. Caffeine. So again, this was one that kind of varies with your doctor. High intakes, but we're talking about like a lot of caffeine, has been linked with a higher risk of miscarriage or the baby dying. But low intakes seem fine. Most doctors will say 1 to 2 caffeinated drinks a day is fine. Others will say, no, you can't have any coffee at all. So kind of depends. Restrictive dieting. Don't want to diet during pregnancy. Definitely don't want to cut out carbs. don't do a low-carb diet. Sugar substitutes, this one kind of varies on your doctor as well. The bottom line with sugar substitutes is, though, for a lot of them, especially the chemical-based ones, we don't know the long-term effects of those. So a lot of pregnant women just like to avoid anything like that in their diet while they're pregnant. Okay, we are going to stop right here because the lactation section rolls right into chapter 16. So we will pick up here on the next lecture.